June 21st, 2021, with my friend. I guess this is Alexa beside me here. But anyway, everyone should have gotten a copy of the minutes from last month's meeting emailed to you. So if you haven't had time, well, I guess you don't have them in front of you, do you?
No, sorry.
Okay, they're not printed, so I hope you had time to look over those prior to the meeting. And Melanie has them up on the screen currently for you to review. And then if we could get a motion to approve those minutes and a second, that would be appreciated.
I have reviewed.
A second.
All right, we have a motion to approve and a second. Okay. Health Council update, if we can get that.
Sure.
Miss
All right,
Sophia.
Very quickly, and I'm gonna move up here so they can hear me. Just very quickly, I don't have a lot going on other than the back to school bash. That is requiring my full attention right now because it is next month. The back to school bash will be July 24th here at Tempora. It will be at the gym. And we will be here from 11 to 3, okay? We are partnering, and I'll pass these around. I'll take one. If y'all can help us distribute those. We're working with CUSC this year, and they are planning to do like kids activities and make it like a family day type of thing. And then we will do the school supply distribution inside the gym, okay? Items are scissors, glue sticks, folders, and just those simple the ones that have the 2 pockets, those work just fine, and dividers. If y'all have any funds or if you guys think you can help us, please let me know. Other than that, that is it. If you guys have any questions about the event, I will stick around for a few minutes after the meeting and y'all can come talk to me, okay? Volunteers are needed too. Thank you.
All right. Great. Now we have the Franklin County Prevention Coalition update. So Jesse?
First, if you are on Zoom, if you can put in your name and email address to sign in, and everyone in person, if you could go around, see the sign sheets around, make sure that you have signed that. It's been a minute since we've had this big of an in-person meeting, so thank you for coming and bear with us as we remember how to do these things and we print because it's been a minute since we've been able to do this. Our biggest update is we will not have a coalition meeting next month. We do not have one in July. We will be here in August. We will open that up in our bigger room, and for whoever wants to come, we will not limit it. However, I do need people to RSVP so we can order the right amount of lunch. Okay, grant funds are tight. I can provide lunch, but I can't over provide, so I definitely don't, I want to make sure I have enough, so everyone RSVP for that. We've got 2 youth ambassadors that have started with us, Elena and Alexis, if you can raise your hands. And that's fabulous. We have a summer vista, this April, and we have a full year vista that you will meet in August. The rest of our updates is on our newsletter, and for the sake of time, please read the newsletter. We spend a lot of time on it, and it has all of our updates on it and everything to come. So make sure you take a look at that.
Okay. A lot going on in this meeting today because we've got a Title VI training that's required, and we had a spotlight meeting as well. So that's why I think everybody's talking really fast because we want to make sure that we give ample time for new business for our monthly spotlight. So with that being said, it is my honor to be able to introduce our monthly spotlight this month. My honor because it's Miss Christine Hawkins, and Miss Christine Hawkins is with the reentry program in Franklin County, and Miss Christine has been my mentor for years. And it is our honor to have you back at the coalition meeting today, Miss Christine, and to share the wonderful work that you're doing at the Franklin County Sheriff's Department.
If you don't mind, I'll stand right here. It is also my honor to see my good friend Tabitha again. We do have a good friendship, and it is always good to see her. I'm going to just take the time I've been gone for the last couple of days in state board meetings and my mind is totally gone, plus my age. So when you take all those things together, you look around and, thanks to having a good staff, I'm pleased to have them here with me today. Of course, you all know Miss Pat, that's been with you, several weeks. Miss Pat is our social worker. Miss Kelly, is the assessment specialist. And then I want to introduce, Miss Jessie Ayers and Ms. Paige Lowe. They're going to be presenting the program. So I'm not going to take a lot of time. Franklin County Reentry has been in existence for the past 13 years. We were the first rural reentry in Tennessee in a rural county. We started in 2007 and it's been going ever since. Of course, we serve inmates that are in Franklin County Jail. We do a lot of programs and we do have brochures today if you all have questions. But I'm not going to take any more time. I'm just going to turn it over to the two ladies and let them talk about reentry. Y'all can go.
Hi, like you said, I'm Jessie Ayers. I am one of the counselors here. I've worked for Reentry for about 3 years now. And then at the end of 2020, we were really fortunate to receive a grant from BOCA, Victims of Crime Act. And that allowed us to really expand the services that we're able to offer to our clients in pre-release. It allowed us to hire our two new counselors, one being Paige Lowe, the other Brian Walker, and to add a full-time case manager. So I'm just gonna real quickly go over the services that we're offering. Pre-release, we offer seeking safety groups, which is an evidence-based intervention for treating mental health symptoms and substance abuse. We offer DBT, which is dialectical behavioral therapy, good for addiction, also to different mental health disorders, generally coping skills. We also have a specific group for treating alcohol and drug problems, and we offer MRT, which I'm sure you guys are probably familiar with, the moral reformation therapy. We also have job readiness classes. We are sometimes able to offer parenting through Campora. We have faith-based sessions, and we try to bring in guest speakers for different programs and community service agencies in our community. Then post-release. We now have 2 job placement specialists to help with employment. We are able to continue counseling with them if that's what they want. We can refer them out for additional treatment, inpatient, outpatient. And we recently started an aftercare group so that our clients can come back to a support group in the community once a week. That's all I got.
I started in.
I'm sorry, Kate, I need you to speak up really loud because their speakers are mics way over here. Yes, thank you.
Okay, I started with Reentry back in January, so I'm kind of the new kid around. Something that Reentry has always been real good about is, creating a better dynamic for people to reenter the community, be functioning members of society, plus help with job placement. And that's always been the mission of Reentry. We're now adding a little bit of a mental health component so these people can maintain where they're at in the community. This way, they have a better shot at staying out of jail, keeping a job, being there for their children, being more productive members of society. I've been blessed with the opportunity and being able to get people to come in and speak. I appreciate Matt and Alan. Thanks for coming and helping. It's been a blessing to say the least, and we're just adding mental health treatment and still pursuing with the mission of Reentry. We just added a layer to it to try and be more well-rounded. Is really where we're at. So.
Yeah, you guys have any questions?
How many clients are you all currently serving?
As a total or on a monthly basis?
I guess on a monthly basis.
So currently, right now, we try to keep a class of about 15 going each month. Now, that's just for sentence folks with the BOCA grant. Now, we have other staff that are seeing people who are unsentenced in the jail, as well as people that we're still seeing in aftercare consistently. So once they come out of jail, they're still with us on that monthly basis. So while incarcerated, 15-ish in class, but plus people who are still incarcerated we've seen. So on average, I'd say I'm seeing about 30 people a month as an individual, but as many times a month as I can see them, if that makes sense. So 30 individuals, but they're getting a lot more services in that month as we roll through. And in aftercare as well with job placement. So once they're released.
What have been your barriers with the aftercare for the clients?
Transportation is huge, housing is huge. You know, we're doing our best to maintain and overcome these, but without a way to work, how can you keep a job? Without a roof over your head, how can you maintain it? So finding housing and transportation services in rural communities is always a big barrier.
There also just aren't a whole lot of service providers in the area. Most of our clients coming out of jail won't have health insurance coverage, so that in itself has been a struggle. We only recently were able to reserve a space in the community to do our aftercare groups. And that's really been a game changer, because people don't want to go back to jail after having, just come from jail to continue to receive services. So just having a place that's neutral in the community where they can all go for these groups is good.
Is the neutral place just for that?
Ongoing, we're kind of using those folks like, briefly. So, yeah, whenever they are released from jail, they're welcome to come and meet us there, and we have the weekly group there as well.
We're very fortunate to have three, master's level licensed counselors in the program. There's actually 12 staff members, and that includes me, of course. But we're very fortunate. I might note that I thought it, since we're sitting in the bridge room, the last female clients that we were offering services to, there were 14 ladies in there. They had 45 children. That was actually of those 14, we had 45. And Paige, talk just a little bit about where you've been going with a lot of these people as far as treatment for 6 months afterwards.
Like where I've been sending or
Yeah.
referring to. So, I was looking at my numbers the other day, and 20% of my caseload, I've managed to send to inpatient treatment. So that is inpatient alcohol and drug services where they actually have a shot at maintaining. I've had a lot of luck with 6-month-long treatment centers that have helped them find jobs and things. Amongst that, probably about 25% or more doing outpatient services with either Centerstone, Mental Health Co-op, Health Connect, and then probably the rest of that are hanging out with me and Jesse and still receiving services from us. We've had a lot of success on not losing a whole lot of people. Now we've lost some that we can't find, but majority of people are actually wanting to stay in treatment, and that's really refreshing to see that we're kind of planting a seed and they're wanting to go further. And a lot of them, when they come in, do not want to go inpatient. That is just not an option for them because nobody wants to go and do that unless they're really ready. But I found through our program that we're slowly pushing that envelope a little bit and trying harder to say, well, why can't you? What are your barriers? What's stopping you? And really, there's not a whole lot of reason unless, they have children and things of that nature. But it's been very interesting to see the movement towards that I need help instead of I'm fine, I don't need you.
So there's a barrier for transitional housing from the time that they're released to the time that they are back into the community. We need some sort of transitional housing facility for them.
And we've been lucky to work with some halfway houses and some sober livings in the community. Like, we've been blessed to have those resources, but there's just not enough.
It's used in that program.
We talked about it a little bit aftercare.
And so that would be transitional housing for males and females.
Absolutely. And we're running into barriers with women with children who are, leaving relationships or trying to start over, finding places they can take their kids with them. That's hard. I'm sure you guys work with them more. It's very hard to get somebody in. They're just very overwhelmed. It's just a timing thing. It's hard, but they do work with us very well.
Ms. Sophia's on our board of directors, so we're proud to see her as well. Pat, hold up, in addition, Ms. Pat has been able to just show a book of all the social services that, like childcare, housing, whatever, that when the counselors need that resource, that we've got something that we can at least try. A lot of counties, but it's a lot of pages in there, different resources.
Are you able to make referrals for their children? We are able to, but I think Paige and I are generally pretty familiar with the community resources around here because we come from other agencies like Sunshine Health Connect. And now that we have had a resource coordinator on board, a lot of times we're able to have her triage, meet with them and make those referrals as needed as well.
And I have had clients call and say, you know, I've got my feet on the ground, I'm doing well, but my kids are struggling. And we always try to send them in the right direction too, but it adds a layer of complexity for sure.
We have a program, actually, the room you're standing in is for at-risk kids, and the grant was originally, wrote for incarcerated parents' kids, so you could bridge the gap from that. It kind of expanded, but if you could, like, use us as a resource, because we work through 3rd through 8th grade.
Okay. And that's real helpful.
We didn't, this program provides a lot of support for the parents.
Or whoever's raising the kids. Well, like, we actually, I think I can say this, okay, we got a guy out to do some, community service with us, and we told him about the program, and it wasn't long, his kid is now enrolled in the program, so that's super cool. So we're getting to support, y'all are on his side, we're on the other family side, so that's kind of cool.
I would like to extend an invitation to you all. Every time we change groups, there's a lot of children affected, those incarcerated people, to actually, if we could set a time for you all to come and speak to the group and let them know that you all could serve their children.
That would be great.
Just let us know when, we'll be
I
there.
don't know who to need to go through, but
On Friday, we have this video program of once a month called Friday Night Unite, where they organize a fun activity and feed the whole thing, so that the family only has to show up. And so there's an activity for them to do, everything, and just like right here, everything for them to do, so very, very good.
Yeah, it's good for family engagement and kind of, helping with some of those struggles. But we've also used it for, you know, we've got grandparents raising grandchildren, and then their child is coming back into their life, and so it is a supervised area to try to reunify that. And so, you know, that was the primary function when we created a grant for that program, so. A lot of ways we can work together with that program.
Thank you, ladies. Appreciate all that. Great work happening down there. Jesse, do you want to talk about the Thrive program?
Okay, let me get up, I wanna make sure I can be seen from both my online. Right here? Am I good? Okay, I don't want anyone to see my back. All right, so let's talk about Thrive real quick. Last year, I probably have to talk it long because I was so excited to provide a youth leadership conference for Franklin County youth. Because last year, everything was closed for COVID. So we did that with 30 youth. It was extremely successful. We still have our group together trying to make some change. And so that was fabulous. And I want to do that again. And I want to go even a step further. We often work with youth saying, hey, get out, do something, step up. We want to hear your voice. And they're like, okay. And that's all we tell them, you know, so they need the leadership training. And so we've opened this up to coalitions across the state. So if, you know, I have regional people I believe on Zoom, and I know you guys work with different regions. So if you've got a youth group somewhere that needs some leadership training, this is the conference for them. It is July 26th through 29th. It's a Monday through Thursday. We have a keynote speaker. His name just left me, but he's from Birmingham. He wrote the book, The ABCs of Leadership. He is well-spoken. He speaks with youth, and he works with a lot of athletes. So you know, he definitely can spread the message to our youth of what is a leader, what do you need to do to get there.
So he's our keynote and he's gonna do a session. We've got, the 7 habits of highly effective youth. That's what we taught last year. We're gonna do that again. So we're gonna teach the 7 habits in the morning, and then the afternoon is sessions they can choose from. Okay, we are providing them with a conference, like a conference I would go to, where you got some things you gotta take, but then you got the things that you can go and get more information as you want. So we've got, suicide awareness. We have drugs and alcohol. We are going to set up our DUI cart, and not only are we going to give them the education as to how alcohol can affect them, we're going to teach the youth how to go back to the community and provide this so that they can run something very similar in their own community. We are going to have sessions on what is a leader? What does that look like? How do you lead your peer group? We've got motivational moments. How can you take a moment and motivate somebody else? So these are the types of sessions that we're having available for the youth to choose from. So if you guys, any of my coalition members, if you have something that you can teach the youth that can be a skill to help them with their leadership efforts, let me know. I am doing a call for presentations and we can set you up. It is afternoon times from 12 to 4-ish is that time that we'll be doing those sessions, and they're 45 minutes each. Now, here's the thing. My coalition's growing, which is fabulous. We have more people, we have more services. I'm doing this conference. My grants are decreasing. So don't ask me how I'm doing it because I don't know, but it's working. But I don't have the grant funds that I did last year. So last year we covered the cost of it completely. This year I cannot. So the cost per person is $125. I am looking for people to help me with sponsorships so that we can sponsor some Franklin County youth for those kids that would really like to go but just can't. I'm also looking for sponsorships to help me with the keynote speaker. Thankfully, we have a great partnership with Camp Rain, and we got that facility, and they are working with me, and they're definitely side by side with this. So that is fabulous. But we do need other financial support in order to make this happen in the community. Again, it's not that I wouldn't write the grant, they weren't available for the things that we do. A lot of that money was just diverted. So, first time I've ever asked for money. So anyone that can help us out, reach out to us. Any questions about Thrive? Registration is now open. They can go to our website, fcpctn.org, and the registration forms are there, along with the scholarship application. Like I said, I need people to help me sponsor the scholarships, but it's not just going to be anyone can get it. This is going to be a competitive scholarship. I want the youth that want to be there, want to make the difference, and want the training. So they have a scholarship that they need to fill out, and our board here is going to help me review. Hi, by the way, board, is going to help me review those applications so that we can, so that we can choose who's going to receive them. So it is, I am asking for it to be competitive. I want our youth leaders to really step up this year.
How many youth are you anticipating to become?
Total, 90. From Franklin County, I would love to get 10 to 15.
Jesse, what is the age?
And middle and high school. But we have a max capacity of 90 unless Camp Rain finds more beds. So, and that does include their counselors. So if we've got youth coming from another coalition, they need to bring people to supervise their youth. We are not taking that responsibility. So, and that 90 includes them.
Have you made any contact with education, possible,
The Department of Education?
yeah, I'm talking about our local board.
I've had conversation with funds, but because I'm grant funded, I haven't gotten anywhere yet. Yes, ma'am.
For the scholarships, are you looking for scholarships for the 15 for Franklin County or for the 90?
No, just Franklin County. Each group that comes, if they want to sponsor, they need to do that. But for us, I'm looking for sponsorships for Franklin County Youth, and that is on the app because anyone can go and register. But the scholarship application does say a requirement is that they are a student in the Franklin County school system. So if they happen to go to another school system, they are welcome to come, but they will not qualify for our scholarship.
If they're in a private school, in Franklin County, they would not qualify.
I had not considered that. I have to be careful because I do work for the Board of Education. And if I'm getting people to sponsor, they have to be willing. So, I mean, that hasn't come up yet. I will find out.
I think we had some homeschool kids last year.
One, I think. So it's just different when it's not my money. So, good questions. Any, Ms. Mann?
Can I say something?
Yes.
So I'm Elena Morrow, I'm the youth ambassador, and I just went with a group from Franklin County to TTI. And what we did there is they learn about drugs, like how to be drug-free, they learn about mental health, and then we sit together and we try to make a plan on how to bring it back to our county. What we found out is that a lot of these kids are dealing with mental health issues, such as suicide, struggling thoughts, and they feel like they can't talk to their teachers, they feel like they can't talk to their parents, they feel like the school doesn't want to help them, they just want to give them a standard test and put them out the door. And so I think that this conference is going to be really needed for our teams in Franklin County. It's going to give them a way to come talk to us, it's going to give them a way to learn how to deal with these things and to be a leader in their school system.
Anything else? Well, hopefully, we'll get some funds available and we can at least, be able to have sponsorships for our 10 kids. You know, that's what, $1,200?
Yep.
$1,200. That's not a lot of money to come up with.
No, it's gonna happen. I have no fear, so.
Okay, Title VI training.
All right,
Let's do
so
this.
this is my first year doing Title VI. I'm a little nervous, Tabitha's got my back. Is anyone new to Title VI training? Has anyone never seen this before? Okay, so if I go too fast, get with me afterwards, okay? Title VI, I know a lot of you guys have to have it for your organizations. Anyone that has grant funds is required to take the training because we have to be Title VI compliant. How does this work? It's not forwarding. Sorry, hold on. Now try. Am I hitting the right button? Sorry.
No, yeah, that worked.
Okay. There we are. All right, so our training objectives is to understand the meaning of the word prejudice and the legal definition of discrimination and the covered groups. Non-discrimination laws and the covered groups that are protected by these particular laws and the efforts on these groups while delivering services. To know how to recognize a possible violation and know your obligations and responsibilities under state and federal laws, and to understand the basic measures needed in order to achieve non-discrimination compliance. Hating people because of the color is wrong. It doesn't matter which color does the hating, it's just plain wrong. Prejudice is an opinion or adverse judgment to anything without just grounds or before having sufficient knowledge. It is also an irrational attitude of hostility directed against an individual, a group, a race, or their supposed characteristics. Prejudice can be used for or against an individual, group, or object. An individual or group can hold prejudice towards another group. You can be prejudiced in favor for anyone with a Southern accent, but can be prejudiced against anyone with another accent. He was prejudiced to give her services solely on her looks. Discrimination is different treatment that favors one individual, group, or objective over another. It is illegal treatment of a person or group based on race, color, national origin, religion, age, sex, pregnancy, disability, citizenship, familial status, veteran status, or genetic origin. Discrimination is often the result of actions based on prejudicial attitudes. In most cases, an institution or entity may treat individuals differently unless the individual is in a protected group or classes as defined under law. It is discriminatory and illegal to deny provided services to an individual based on race, color, national origin, or having limited English proficiency. It is discriminatory to provide a service differently than what is provided to others, at least in part, because of color or national origin. It is discriminatory and illegal to deny employment to anyone based solely on the fact that a person uses a wheelchair. It is discriminatory if an agency offers services to recipients ages 1 to 21, and you deny persons services because your belief is at age 21, recipients do not need services. So age is also a defining factor. These are the federal laws and regulations. You've got Title VI, Title VII, Title IX, you got Section 504. So there are different laws. They all come down to one thing. Let's just treat people equally and with respect. We're going to focus primarily on the Title VI of the Civil Rights Act of 1964. So y'all kind of read this one. Simple justice requires that public funds to which all taxpayers of all races contribute not to be spent on any fashion which encourages, entrenches, subsidizes, or results in racial discrimination. Direct discrimination by federal, state, or local governments is prohibited by the Constitution, but indirect discrimination through the use of federal funds is I don't even know, and should not be necessary to resort to the courts to prevent such individual violation. So anything that has federal funds or state funds, we need to make sure that we are compliant with Title VI. No person in the United States shall, on the basis of race, color, national origin, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. Denial of any service recipient, any services, opportunities, or other benefits for which an individual is otherwise qualified. These are prohibited practices. Provide any service recipient with any service or other benefit which is different or provided in a different manner from which is provided to others. And subject any service recipient to segregation or separate treatment in any manner related to his or her receiving. More prohibited practices. Restrict the service recipient in any way in the employment of services, facilities, or any other advantages, privileges, or benefits provided to others under the program. Adopt methods of administration which would limit participation by any group. Notes inferiority because of race, color, and national origin. English proficiency is defined as an inability to speak, read, or write or understand the English language at a level that permits a service recipient to interact effectively with staff in accessing public services and benefits. So when I took this training, the biggest thing I learned is it's not just someone who speaks English as their second language, but this could also be somebody who just doesn't read. That if they have problems reading and speaking English, we need to provide them with a way to understand. Executive order requires all agencies that receive federal funding to provide services that are accessible to persons with limited English proficiency. Not providing services that are accessible constitutes discrimination based on national origin. So to be compliant, we need 4 elements of the effective language assistance. We need to develop and implement written policies and procedures for language access, assess language needs of your consumers and community, train your staff regularly, and monitor vigilantly. So things that we can do is provide oral interpreter services, having bilingual staff, use telephone interpreter lines, have written language services, and volunteers in the community. Title VII is for employment. Prohibits discrimination by covered employers on the basis of race, color, religion, sex, or national origin. Also prohibits discrimination against individual because of his or her association with another individual of a particular race, color, religion, sex, or national origin, such as by interracial marriage. In the late 70s, began to prohibit sexual harassment as sex discrimination. And in 2012, employment discrimination on the basis of gender identity or transgender status is prohibited. Okay. Section 504. Section 504 prohibits organizations and employers who receive federal financial assistance from excluding or denying qualified individuals with disabilities an equal opportunity to receive program benefits and services. It defines the rights of individuals with disabilities to participate in and have access to program benefits and services. Qualified individuals with disabilities are persons who have a physical or mental impairment that substantially limits major life activities, and one or both of the following, with reasonable accommodations, can perform the essential functions of the job for which they have applied or been hired to perform, or in terms of assessing and receiving public services and benefits are persons who meet the normal essential eligibility requirements. So if there's just a little bit that we can do to meet them where they are and they can still do the job, then, we need to look at them. You can't just discriminate against them. Physical and mental disabilities include, but are not limited to, visual, speech, and hearing impairments, intellectual disabilities, mental or emotional illness, cerebral palsy, epilepsy, muscular dystrophy, multiple sclerosis, orthopedic conditions, cancer, heart disease, or diabetes, contagious and non-contagious diseases such as tuberculosis and HIV. Reasonable accommodations requires an employer or government agency to take reasonable steps to accommodate a person with a disability unless it would cause undue hardship. So we, wouldn't be asked to put in an elevator because we have 2 stories next door. But if someone has to, utilize another entrance so that they don't have to walk up the steps, that would be a reasonable accommodation. In relationship to accessing public services and benefits, covered entities must take reasonable steps to make sure that a person with a disability can access programs, services, benefits, or has opportunities to participate. This includes the opportunity to participate regardless of physical barriers. The ADA, so the Americans with Disabilities Act, ADA of 1990, is based on Title VI. It provides comprehensive civil rights protections to individuals with disabilities in the areas of employment, state and local government services, public accommodations, and transportation and telecommunications. Unlike Section 504, compliance is mandated for state and local governments or businesses that serve the public, even if they do not receive federal funds. Qualification of individual with a disability is a person who has physical or mental impairment that substantially limits major life activities, has a record of such impairment, or is regarded as having such an impairment. Decisions about whether or not a particular condition constitutes a disability within the meaning of the ADA of 1990 should be based on a case-by-case determination. So some examples are of physical and mental disabilities is the same. Major life activities means functions such as caring for yourself, performing manual tasks, walking, seeing, sleeping, eating, interacting with others, hearing, speaking, bathing, learning, concentrating, thinking, or working. It's important to note public entities must consider the ability to access services and benefits and reasonable accommodations. Interpreters, television, captioning, telecommunication devices, accessible sidewalks, doors, and water fountains, braille materials, large print, and auxiliary aids. So we also have to watch how we talk to people. So we have some examples of preferred terminology. So it's calling someone a person with disability, people with disabilities versus crippled, deformed, the disabled, handicapped. So there's a large list. I'll let you guys read it. My new people, if you need me to print that for you, I can. Age discrimination protects individuals who are 40 years of age or older from employment discrimination based on age. The protections apply to both employees and job applicants. Under the Age Discrimination Act, it is unlawful to discriminate against a person because of his or her age with respect to any term, condition, or privilege of employment, including hiring, firing, promoting, laying off, compensation, benefits, job assignments, and training. Age Discrimination Act applies to persons of all ages. Age Discrimination Act does not allow for certain exceptions that permit under limited circumstances the use of ages of distortions or factors other than age that may have a disproportionate effect on the basis of age. Education amendments, they apply to education programs and activities, prohibits discrimination based on the individual's gender. No person in the United States shall, on the basis of sex, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any education program or activity receiving financial assistance. Tennessee became the first state to pass this. So keys to effective civil rights compliance: ensure that the service recipients are receive equal treatment, equal access, equal rights, equal opportunity, without regard to their race, color, national origin, including English proficiency, age, gender, or disability. And civil rights compliance is enforced by people that make complaints, compliance reviews, and agency activities such as education, training, and technical assistance. If someone, a person should feel that they have, a person feel, there we go, that they have been discriminated against from an agency providing services, they can file a complaint. They can do that through the county here. And then we have to turn that in and we have to address it. If anyone feels that our agency is having fraud, waste, or abuse, then that should also be reported. We do have these signs throughout our building. It is illegal to fire, demote, harass, prevent services, or otherwise retaliate against people because they have filed a charge of discrimination, because they complained about discrimination, or because they participated in a discrimination proceeding. Everyone should feel free to talk about the way that they're feeling, and we just cannot retaliate against them. Compliance reviews, we are monitored, and they go through and take a look at any of our complaints and make sure that we are compliant, and then I have to serve a survey every year. They do provide training to the coordinators every year. Coordinator duties. These are the things to know, the protected classes, and what law correlates with each. It's a lot of information to remember. Individual states can and do create other protected classes, which are protected under state's law. If you have any questions on that, you want to go to Tennessee.gov. The difference between Title VI and Title VII. Title VI prohibits discrimination in programs on the basis of race, color, or national origin. Title VII prohibits discrimination in employment based on race, color, national origin, gender, or religion. Persons who are limited English proficiency, remember that is someone who doesn't speak English as the first language. They have a hard time reading or writing English, even if they speak English at home. Persons who are deaf or hard of hearing, a person who is blind or have low vision, and persons who have service animals. Auxiliary aids are having things like sign language, video remote interpreting, large print material, closed captioning. A qualified interpreter is someone we have to provide for free in a timely manner. We do not require individuals to have their own interpreters, and we cannot rely on minor children. We need to have a document, like a written policy on our LEP. Examples of program services non-compliant with Title VI. So if we deny any individual any service, financial aid, or other benefit, provide a service or benefit to an individual who is inferior either in quantity or quality that's provided to others, provide an individual with a service or benefit in a manner different from others, subject an individual to segregation in any manner related to the receipt of services, or subject an individual to separate treatment in any manner. Other examples of noncompliance would be restrict an individual in any way to the receipt of an advantage or privilege enjoyed by others, require different standards or conditions as per requisites for accepting an individual into the program, deny a person the opportunity to participate as a member of a planning advisory board, which is an integral part of the program, utilize criteria or methods of administration which have the effect of subjecting individuals to discrimination, or permit discriminatory activity in a facility building in whole or in part, funded by federal funds. Failing to provide services or information in a language other than English when sufficient numbers of potential or actual beneficiaries are of limited English ability. Failure to advise the population eligible to be served or benefit by the program of the existence of the program. Subject an individual to discrimination in employment practices under a federally funded program whose objective is to provide employment. Locate a facility in any way which would limit or impede access to federally funded service or benefit. We do have a written complaint process and complaint log. You can find that on our policy and procedure manual. Once a complaint's been made, we do have to report that to the state, and again, complaints go to the county office. Okay. Oh, hold on. We do have this disclaimer on our brochure's website and such, saying that this agent and that the Prevention Coalition is funded by a grant from the state of Tennessee Department of Health Substance Services, whereby no person in the United States or in Tennessee shall, on the basis of race, color, national origin, be excluded from participation in, be denied benefits of, or be subjected to the discrimination under any program activity receiving federal or Tennessee state funding. So we do have that on the majority of our forms. We do have it in our brochures. And then we do the survey, the non-compliance statement, and these are the posters that are there. So in conclusion, in both the United States and Tennessee, everyone has the right to fair and equal delivery of services, regardless of race, ethnicity, national origin, religion, political affiliation, level of education, place of residence or business, age, gender, marital status, physical appearance, mental or physical disability, sexual orientation, genetic information, or source of payment. Sorry, I know how boring that is for me to go through and read that, but I appreciate everyone sticking through it. And if you've never seen that before, then I can definitely print that out because it is good information for you to go through. Any questions, concerns, comments? Oh, I have 11 minutes yet.
Everyone, please make sure you sign in the sign-in sheet and put your name in the chat box, and we will send your certificate to you by email.
Yes. We should have that by the end of the week.
Sure.
Okay. All right. Any other questions?
That was different, we definitely, like a copy.
Okay.
The one we have, I mean, ours was just a film like this is like really.
Excellent. Excellent. I'm glad. Okay.
All right, thank you, Jesse. I'm so glad I don't have to do that. But with that being said, I did it for years, and it is important, just as reminders, especially if you're receiving federal and state dollars. They take it very seriously to be in compliance. So just to know that, and but thank you all for sitting through that. Announcements and upcoming events. What is the Youth Transition Summit? Is that you?
Health Department.
Is that you, Sophia? The Youth Transition Summit, June the 24th,
Yeah,
22nd, 24th, and 29th? What is that?
Honestly, they just sent it to us from Nashville, but I think it focuses on like, how, you know how kids, when they're in their youth years, how they go through certain things during those youth years, and it focuses on how, growing, like it teaches them how to grow and make good decisions and, life skills.
nice. And where is this gonna be held at in Franklin County? Or is it?
I think it's virtual.
Oh, it's
Both
virtual.
days.
Okay, well, good. Good. There we go. 2021 breastfeeding symposium, is that you too, Sophia?
I just forwarded that to you guys, but yes, that is in Nashville.
Okay.
I don't have that one.
Oh, okay.
I do think it is.
It's in Nashville, in person and virtual. There are certain agencies that work with moms that are breastfeeding. So that symposium is focused. For that program. If you guys want more information about that, I can send you that. Flyer.
I'm pretty sure there's a flyer right as you walk out the door right here.
So the Isaiah 117 is having a fundraising concert, June the 25th. So that's pretty amazing. Camp Rain, I know you had a youth camp already, and 2 more camps coming up. 2 more. Back to school bash, Sophia, you've already talked about that. Jesse, you talked about Thrive, a golf tournament for Isaiah 117. So that's coming up September the 24th. So have a new child advocacy center in Franklin County. So that's wonderful news. I saw that. That's located on the grounds here. Barbara, tell us about it.
They have their grand opening on Friday, and they will be there every Thursday.
Okay, so every Thursday. All right,
Do you know
wonderful.
what they provide? They do, special interviews for victims of.
Wonderful. Wonderful. That's been a long time coming for Franklin County. I'm so glad there's at least a space for that now. I would love to see a house or a center, but, baby steps, baby steps. Wonderful. All right. So anybody else have anything that you need to add to the agenda? So happy again to have Franklin County Reentry Program, coming out and being the highlight for today's meeting. You all are doing great things down there. I know you are. Miss Christine only puts the best around her, and I know you all are learning from the best. So just absorb it all. Absorb it all. So anybody else have anything?
Any of our Zoom people have anything that you want to share that you have going on?
Thank you. I forget about them. Yeah. Well, everyone be safe. Enjoy the summer. Enjoy the break from the meeting. But do know that Jesse and the coalition are needing some money. At least $1,200 for this Thrive Camp for at least 10 kids from Franklin County. So for all of you who are in the room with us today or participating on Zoom, if you can sponsor one of those youth to attend the youth conference, I know that would be very much appreciated.
Absolutely.
Okay, next meeting will be August the 16th, 2021 at 12 o'clock. Can I get a motion to adjourn this meeting? Okay. One second over there. All right. Thank you all. Thank you all on Zoom for joining us today. And hopefully we will see them in person in August as well. All right. Thank you, everyone.
Thanks, guys.